Even if you're not an athlete, knowing this information can not only help you monitor your fitness level, it can also help you spot developing health problems. Joining me now with more is Dr. Shobha. And Dr. Shobha, it's always good to have you on the show.
Good to be here.
Talking today about sort of taking your pulse and your heart rate and why that's so important. It seems like that's something we kind of forget about.
That is true. And I just want to clear a misconception between blood pressure and heart rate. Heart rate is or your pulse rate is the number of times your heart beats in a minute, and you check that normally at your wrist.
Okay.
This way or that way, or usually up in here.
Okay.
Or more commonly, you can check it with one of your blood pressure monitors, either that you have at home, or actually if you go to any grocery store or pharmacy, they'll give you both your blood pressure and your heart rate. Blood pressure, on the other hand, is the force with which your heart beats, and you have two numbers to it, 120 over 80.
Right.
So 120 is the maximum force with which your heart squeezes, and 80, or the diastolic number, the lower number, is when your heart relaxes, what is the least force that your blood vessels have in your body. So 120 over 80, when you have two digits, that's your blood pressure, and heart rate is the number of times your heart beats a minute or beats per minute. In the past, we always said your heart rate should run between 60 and 100, and anything less than 60 is bradycardia or slow heart rate. Anything over 100 is tachycardia or rapid heart rate. But what we have found in the cardiology community is that the normal resting heart rate, and I'm talking resting where your mind is at peace,
Which is very
small
hard. Windows during the day.
Correct. And you have not really run around doing all your activities. You're really at rest for the past 10 minutes. Your mind is at peace. Your heart rate generally runs between 50 and 80.
Okay.
So the higher you have, closer to 100, that's not right. If it's running less than 50, either you're an athlete, you're very well built, and you're really conditioned your body, or there may not be something, quite right.
Okay.
But heart rates in the 40s are not necessarily abnormal. It is individualized, but generally 50 to 80 or 50 to 90, for the most part is normal. And so when people know, so we need to always try to figure out, are you a normal, healthy person? Are you at risk for heart disease? Or do you already have heart disease and are you taking medication? So there are different heart rate goals for your individual normality.
And knowing these is key. How often should we be, we're so fortunate, like you said, to have these little tools set up now all over, and they kind of give you the key of what's normal. How often should we be checking something like this?
I hate to tell people that you need to check it, every so often, because it might get them too worried about their pulse rate, and just the worry about checking their pulse might make their heart rate go up, and it might make their blood pressure go up. I've had patients in my office who've been checking their blood pressure 4 or 5 times a day, and it goes up, and they get so worried that it's a little bit up, and the next time they check it, it's even higher. And so your focus should not be on that. Check it once in a while, or when you go to a physical, you have it. Now, if you're somebody that's going to start an exercise program, then you might want to check your resting heart rate and discuss with a healthcare professional what your goals should be. Here's what we generally say in the cardiology community: 220 minus your age and years.
20 minus your age and years.
220.
Okay.
220 minus your age and years, that is your maximum target heart rate.
Okay.
That is your maximum heart rate that you want to achieve. You achieve too high heart rates beyond that and you sustain them, it is generally not physiologically good for your heart. You don't have the advantages, you may have more disadvantages on your bones and to your heart. So you don't want to exceed that for any prolonged period of time.
Okay.
Now, what you want to target your heart rate to is 220 minus age and 85% of that. When you achieve that target heart rate, 220 minus age times 85% of that, then you're achieving a lot of benefit. But you may want to start slower, 50 to 85% of that target.
Okay. Well, certainly a lot of information. We're going to give everybody a website. If you would like these numbers, you want more information, something you just need to be aware of, do check out this website, heart.org. You can find out all kinds of life-saving information. And Dr. Shobha, you'll come back and see us again soon, right?
Yes.
Always good to have you on the show. Thanks for joining us. We're going to take a break. We're back with more right after this.